Matters in COVID-19 webinar. My name is Travis Mitchell. I am a local pastor here in Brewster, New York. I also am associated with the Brewster Rotary, which we're co-hosting this with. And also I serve as a board member for the Mental Health Association in Putnam County. And so 6 weeks ago, I just knew that conversations need to happen regarding mental health, and what better way to celebrate Mental Health Month, which is May, which one of our panelists, Megan, will say is Self-Care Month, which is excellent. So I just wanted to get some local experts in to answer some questions, a time for the community to ask questions, whether the community is in Putnam County or somewhere in the U.S. or as we've heard, someone from Florida. So that was my heart, and I wanted to do it with the Brewster Rotary, which I will turn over to Paul to introduce our panelists. Let me just mention a few things. One is we ask that everyone's on mute. That way, because this is being recorded, and all the background noise will ensure better quality. For the panelists, you'll be on mute, but when I call on you to answer a question, you can just turn yourself on and answer. That's kind of Zoom etiquette. And I think that's, Paul, I'm going to turn it over to you to introduce our four panelists.
Do they know who I am?
You are the president of the Brewster Rotary, and I know if you want to feel free to mention a little bit more about yourself, go ahead, and then move on to our four panelists.
First of all, I'm honored to be here, not only as the president of Brewster Rotary, but to someone, those of you that know me, know that mental health is very important to me, especially when it affects people in your family. I think it affects everybody. I don't care where we are. Everybody's got mental health to deal with in their family, one way or the other. But on behalf of Rotary, I cannot tell you how proud we are to sponsor this, and how proud I am to be person that you've asked to introduce our panelists. So let's get going on that. First of all, where's Claire? I can't see everybody's picture for some reasons. Claire's with us, right? Did Claire come on?
I'm here. Hi, Paul.
Hi, Claire. Claire is the division director of the community-based services at Green Chimneys and has been with the agency for over 20 years. As the director, Claire oversees and manages 7 programs that provide supportive and therapeutic services to over 500 youth and families a year in a variety of settings. Claire is also a proud member of the Brewster Rotary Club since 2017 and serves as one of Brewster High School's Interact Club moderators. I can say this, she is a very, very important part of Brewster Rotary. We have Jane Amsden, is that correct? Is Jane here? Yes? Okay. Jane is the program director of mental health counseling and treatment services at Cove Care Center. In this role, she oversees all clinical and administrative oversight of the staff, records, and related policies, procedures, and projects. She has been working in the community clinics for over 30 years. Dr. Martin Vigder, as his friends know him as Marty, or as I know him as Viggy, is a former clinical is a former clinical director of Green Chimney School, where he served for 36 years, supervising diagnostic and treatment services. He has a history of over 50 years working as a psychologist in a hospital and residential treatment settings, as well as in community mental health. He has worked therapeutically with children, adults, and seniors, and is currently in a private practice in Pleasantville and in North Salem. And Marty is a very special friend of mine. Megan, where are you? How are you, Megan? Megan has served as the executive director of the Mental Health Association in Putnam County for 23 years. 2 years ago, she was rightly awarded one of Putnam County Women Trailblazers to honor her relentless work on behalf of the community. She is currently embracing her new role of homeschool teacher to her 2 children. We welcome her insights in today's webinar. There you go.
Thank you, Paul. Thank you.
Well, thank you, Paul, for introducing our panelists, and again for the Brewster Rotary for co-hosting this, and for anyway. So here's the format for our webinar. Our 4 panelists have been given 5 questions, and we're going to walk through these 5 questions. That should take maybe like 45 minutes. During this time, if you yourself have a question that you want to direct it to one of our panelists or all our panelists, please use the chat feature. And there'll be a Q&A time where we're not going to verbally ask the questions, but we're going to use it, just write it on the chat feature, and we'll get to that. Paul and I will moderate the Q&A. So we want to begin, and I'll give some reminders throughout this that we have that chat feature, and you can write your questions. The first question, and I'm gonna have Megan begin, is, and you'll see that on your screen, is we don't want to assume, even though most of us here have a passion for mental health, I don't want to assume that we all are on the same level, but I want to ask the basic question: what does mental health mean to you, and what are some of the common misconceptions people have about mental health? And so, Megan, we'll start with you, and then we'll go with you, Jane, then Claire, and then Marty.
Thank you, Travis. You can hear me? I'm unmuted. Great. So I want to thank you for bringing us all together. This is a great opportunity to have this conversation, and it's Mental Health Awareness Month, as you mentioned, and I think that mental health matters now more than ever with everything that's going on. You know, we've always had our services geared towards people that have mental health issues, and I think our services now are for everyone, because COVID has, you know, put us all in a situation where I think it's impacted our mental health, or, you know, what I would refer to as our emotional wellness or our emotional well-being. So that's really what mental health means to me. I think that your emotional wellness, your mental wellness, is a really important, critical component of your overall wellness. And I think it's one that we don't always take the time to stop and pay attention to, because we're busy, you know, focusing on lots of other things that need our attention. And especially right now, but this is a time that we really need to take time out and pay attention to what's going on with us in our minds, and how things that are happening in our minds can affect our bodies and our health, particularly with stress or with anxiety, and making sure that we're doing things to take care of ourselves just like we would if we had diabetes, or if we had heart disease, or we had some other type of medical issue that needed attention. You know, not something that we would ignore, but that we would make sure that we were tuning into and taking care of. So I know the second part of the question was about misconceptions, and you know, for anybody who has lived with a mental health issue, you know that there's a lot of stigma often around mental health. It's something that people are not always comfortable speaking about, which is unfortunate, because just like diabetes and heart disease, it's treatable, and we should be talking about it, and we should be reaching out to get support and make connections, because there's no reason, there's no shame in having a mental health issue. You know, it's part of your overall wellness, and being able to make sure that you're taking care of that is really important. And I wanted to just echo what you said about it being Mental Health Awareness Month. It is Self-Care Month, and we were just using this analogy for anybody who used to fly on an airplane before COVID, that the flight attendants will always tell you with the oxygen masks that you want to make sure that you put yours on first, so that you can take care of someone else. And so I feel like that's what we all need to be doing right now to make sure that we're taking care of ourselves so that we can take care of other people.
Yeah. Yeah. Thank you, Megan. What is an airplane now?
I know.
But thank you, Jane. You're up.
Hi. Am I unmuted? Yes. Okay. So, I mean, for me, I think that the new circumstances of COVID have brought new awareness to people on so many levels about things that they thought they knew about themselves and the world around them. And I think that that has a lot to do with mental health, or it certainly impacts mental health. Not only are people, you know, certainly as Megan was saying, are heavily impacted emotionally by what's going on. For some people, COVID is an event that other people are experiencing, not them. And for some people, it's a tragedy right in their own life. But I think that for me, mental health has a lot to do with self-awareness and balance in one's life, doing things deliberately and mindfully. And that doesn't always mean that things are going to be going well, but they will feel like they are in some way manageable, or you are ready to take the next step in taking care of whatever needs to be taken care of. And I think that being honest with oneself about how you're feeling and what you need is a very important part, being able to reach out for help when you need it. And to not believe in the idea that everything has to be perfect, excellent, happy. You know, I think a lot of times in the work that I do with folks, there's a belief that, you know, if I need mental health services, it's because I'm not happy. And once I engage in mental health services, I can't stop until I'm happy and my life is terrific. And that's a big ask. You know, I think that for a lot of us, saying, you know, trying to define what that is difficult. I think that we need to think in terms of, am I coping well enough? You know, when we hold ourselves to a standard of my life has to be fantastic, or I'm not healthy enough, we're not doing ourselves a service. I think it's so important to be able to say, I'm getting through my life. I'm getting through this moment. I'm coping. I'm okay right now. I can get from here to the next spot in my day or my week or my life. There's a lot of mental health in being able to say those things. I think also in terms of misconceptions, you know, that's part of that answer, is that people feel like they have to be able to manage everything. You know, one thing that we know is that things come out of left field, as this has, and it's not always tolerable or manageable, and it's okay to ask for help. Everywhere you turn now, there's a message saying, if you can't manage right now, ask for help. And that's so critical. Nobody has to have all the answers to what constitutes their own health or their own needs. It's okay to say, I don't know. It's okay to say, I need something, but I don't know what it is, and to ask somebody to help you with that. You know, and to not assume that that means there's something pathologically wrong with a person, but simply that there's something they're reacting or responding to that they need help managing. And the process of managing with awareness of that decision to do so is a big part of mental health.
Thank you, Jane. I mean, well said. Honesty, self-awareness. Claire, you're up.
Okay. Hello, and you know, thank you for having me. What mental health means to me, it's a feeling of well-being and the confidence in one's ability to navigate and to manage life's daily demands. Common misconceptions, you know, in my experience, include that people believe that there is an inherent weakness or deficit in people who struggle with mental health challenges. The fact is, I think we all have, mental health challenges from time to time. We all run, a gamut of experiencing emotions, sadness, grief, anxiety, frustration. Fluctuations in our mental health state are normal. I think it's only when these fluctuations become constant or consistent, or interfere with our daily living would we start to really seek outside interventions and help.
Thank you, Claire. It's so refreshing to hear yourself, a mental health professional, say, "Hey, we all have mental health issues from time to time." So thank you for just acknowledging that reality. Marty, you're up with question 1.
Travis, thanks for inviting me. I've been pondering what is mental health for about 50 years. Okay. When I was a graduate student back in the 1960s and 70s, there was a book that came out called The Myth of Mental Illness. They tried to say that, that calling people mentally ill was political. Okay. Somebody took exception to that and wrote an argument book called The Myth of Mental Health. So, and the truth is that mental health and mental illness are a continuum. It's not an all or nothing thing. Studies that have been done show that there are many people who would qualify for mental health diagnoses but never seek treatment. And sometimes it takes an external crisis like COVID to actually get people to seek out help, okay? And the thing with whether one's mentally ill or not, most people at some time in their lives have symptoms, okay? Anxiety is normal. Depression is normal. It's a matter of degree and how persistent those phenomena are, okay? What's important at a time of crisis like at the present time is not to be too judgmental about it. People are judgmental about mental health, and there's certainly a stigma that people still feel and shame about sharing any information about themselves or the problems they have. We need to be less judgmental about others and about ourselves at this time and more supportive. If you want something concrete, I can tell you what the World Health Organization says. Mental health, the World Health Organization says, is, quote, a state of well-being in which an individual realizes his or her own abilities and can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. An important component of mental health is self-esteem, feeling good about oneself. Feeling good about oneself happens when one is productive or contributes. If one can't, and often people who are suffering from mental illness become paralyzed in terms of doing things for themselves or others, so they really need help. And as each one of my fellow panelists says, calling for help is like really important. And I like an advertising slogan that a depression clinic at Portchester's Hospital puts forth. It says, it's not a sin to be depressed. It's a sin not to get help when it's available.
Thank you, Marty, for taking us back to history of 50 years ago. And so thank you for your,
People have been
just want to
debating.
honor you. Yeah. I just want to honor you, Marty, for the 50 plus, your passion for this for so long. Next question. You all kind of touched upon this, but we really want to zoom in with our current crisis of the COVID-19 pandemic. How has this amplified the need for mental health? And we'll start with you, Jane.
1 minute. I have to find her.
There, can you hear me? Can you hear me?
Yes.
Okay.
Let me start again, sorry. Okay. I think that under the current circumstances, one of the key things here, there are a couple of key things, but one of them is the disruption of routines. You know, people kind of build their lives on certain routines. You know, you get up in the morning, you know, the kids go to school, you go to work, or you have breakfast at a certain time, or you do certain tasks, or you don't, or you have expectations for certain events occurring that tell you that your day and your life are ticking forward, and, you know, you're oriented to that. And when those routines are disrupted for a lot of people, that's, you know, extremely difficult. And I think that for almost everybody, that's been a huge, huge impact because of this pandemic. Things that we thought we had nailed down in our daily lives and we didn't have to worry about, and we could just kind of go and do those so that we could devote the rest of our brain to things that really needed our brain power or our energy. No, now we have to turn our brains just to figuring out where do we go or don't go every morning. The kids don't get on the bus. Now what do I do? Do I have a job? Now what do I do? And so things that were very fundamental, you know, like our fundamental structures of our lives have been knocked out from under us for many, many people, with the possibility that it might come back, but maybe not. And so the level of ambiguity is huge, and very few people like ambiguity. So that gives rise to a tremendous amount of anxiety. Also the limitations that are imposed from the outside, you know, whether it be feeling cooped up, which some people like. I mean, honestly, in my clinic, what we're noticing is that people who would otherwise not come to appointments are fine if we call them, because telehealth means we call you. You don't have to come out of your house to us. So we're actually getting a lot of sessions with people who otherwise wouldn't be keeping sessions because they're okay as long as they can stay home and we call them. So that's working for a number of people who are very pleased to have the whole world turn and operate the way they've been operating for a long time, which is pretty much from their homes with much less contact with the outside world. But for people who are used to routinely going out and interfacing with the world, it's a heck of a thing to either feel cooped up or to feel like the connections you make in the world aren't there anymore. I think what we're gonna find is, you know, that because the connections to life outside of our own homes has been diluted so heavily, and for some people, they really do feel cut off. You know, I'm lucky enough I can Zoom, we can Zoom, but there are a lot of people who they don't have the computer equipment or the electronics, and it's this, you know, their lives have been dialed back, or they have to make choices to see people face to face or not at all in some way. And they're, you know, it's a big deal for people to stay in touch, and that's hugely stressful. But I think what we're going to find is because families are together and people are together in ways that they probably didn't plan on, and we're kind of counting on the opportunity for the kids to go to school and I go to work and this other one, and we're not together 12 hours a day. Now that they are, the conflicts and the stress are escalating. And I think that when people do come back out into, you know, community settings, and we do speak to them more face to face, we're going to discover that there has been a great deal of conflict and frankly a lot of abuse that has gone on that we're not necessarily hearing about directly, because certainly when it comes to domestic violence and child abuse, way more happens that doesn't get reported than does. And we hope that it gets reported and addressed, but I think we all know that a lot of it doesn't. And I think that the stress that's going on now is seriously escalating some of the conflicts at homes, in homes, that will be discovered when people begin to leave their homes. I think people who counted on the, you know, external forces and demands of life requiring them to get up and get out and go places and become presentable in the community keep people functioning. It keeps them from necessarily doing things that would be self-destructive. For some people, it's physically self-destructive behavior. It could be drinking or drugging or cutting or whatever the behavior is that they would do when they're anxious, and there's no one there to say, hey, you can't do that. And there are a lot of people who now at home don't have a real external reason to present themselves better. And it's easy to kind of stay home and to fall back into some negative habits. And so our efforts to continue to reach out to the community in every way we possibly can to say, you're not alone, let us help you hold it together during this time, whether it be because there's too much stress in your life or because there's not enough structure in your life. Let us help you maintain the balance there so that you can keep functioning in the face of this stress.
Well, thank you, Jane. That was a lot. Just to let everyone know that this is being recorded, and we'll provide that to you, because you mentioned a number of real challenges. Claire, you're up. What would you add to this question?
Okay. Okay, so challenges. I believe that pre-existing challenges are now being magnified and exacerbated. The fact is that mental illness is very isolating, and many mental health struggles, they're eased simply by connection and conversation with other people, with their families, their friends, people in the community. That's a really significant challenge right now. People are cut off from seeing people, touching people. I would say, also to really echo what Jane was saying, additionally, most people are familiar with routines. They're comforted by routines. But I would think maybe one of the greatest impacts from this is the insecurity, the sense of vulnerability caused by this virus, the fear of illness, potential loss, financial security, even food security. I think that it can create a tremendous emotional strain and even otherwise very confident and calm people.
Thank you, Claire. Marty, what are your thoughts to this question?
Well, the greatest stress of all is uncertainty. Okay. A year or two ago, we all used to go for our flu shots, and there was a procedure and a pathway that you know what to do to prevent yourself from getting the flu. Suddenly we have an unknown illness, a novel illness that comes along. It's not been charted. It doesn't have a clear path. We don't exactly know what to expect. And we're flooded with all kinds of information that we don't know how to process. So we suddenly find ourselves kind of lost, okay? And the being lost is what creates the stress for a lot of people. In reports that I've read, nearly half the adults in the United States have reported that their mental health has been negatively impacted by worry and stress over the virus. So this is not an exceptional thing. This is common, okay? And a lot of people are doing it. And what we're being told to do to stay safe, stay home and save lives. I think that's what they say. So we stay home. How many of you have been home for how many weeks? And compare it to how you were before. Most of what we do is we're doing Zoom meetings. Actually, I'm an old guy. I know a lot of old stuff, but I didn't even know about Zoom until about 2 months ago. So I've just been trying to figure out how to do the Zoom thing. And I'm listening to you, but I'm also trying to figure out which button I click on my screen so that I'm responding to the right person. It's all a learning curve for us, dealing with the uncertainty of it. But what we're being told to do is in lots of ways, it may prevent us from getting the virus. by staying by ourselves, by wearing the mask, by wearing the gloves. I saw some guy at the pickup place at the supermarket the other day, as he was putting the bags into his hatchback. I saw him take out a spray can, and he sprayed every single bag with some type of disinfectant spray. I mean, this is like weird. You know, if you think compared to the way we were in the old days, if you saw a guy walking around with a spray bottle spraying bags of groceries, you'd think he needed mental health services. Now that's the norm. So lots of things are topsy-turvy these days, and that's what makes it difficult and what makes people symptomatic. Obviously, fear and anxiety don't do a lot for mental health, and what everybody's saying about the importance of connection and contact is the same. Those of us who are in Rotary, we get together every week for years and years, and we talk to each other, we know each other, we eat together. Now we see each other in little squares on our screens, okay? And we have to, that's a substitute. Those of us who do, telehealth, we talk, as you don't have to call us, we'll call you, okay? So we call patients and review what's happening, but the social isolation is really not conducive to mental health. Actually, a lot of people who have mental health conditions prefer to be isolated. They don't want to get together with people. They don't want social contact. And yet it's the social contact that can have the healing properties. And as I say, social isolation, job loss, worrying about finances, none of that is conducive to a sense of well-being, but it's the cards that have been dealt us, and it's what we all have to cope with. So there are services out there. You've got my colleagues and me here, and there are lots of stuff that's offered online. It is important to make those contacts. The first contact is a tough one.
Megan, why don't you wrap up this question with your thoughts?
People, in order to deal with unfamiliar circumstances, it's important to have a support system. Everybody needs a support group. Very often with people who have mental illness, the community mental health clinics are the support system. So people can get together in day programs, but even that is disrupted. So this is the way we have to contact each other these days, online through Zoom and things like that. At some point later on, Travis, I'd like to hear from you about how religious services are going on at this time.
So, yeah, thank you, Marty. We'll that might be one of the questions after this. But Megan, you're up to give us your thoughts to the challenges.
Sure. Thank you, Travis. So I just want to echo everything that all of my fellow panelists are saying. And, as you're talking, I'm just thinking it's been something that's been recurring in some of our conversations. It's like mourning losses, like the loss of routines, the loss of plans that we made, vacations we were going to take, get-togethers we were going to have with families. So all of these things are just disruptive. And so we've been seeing a lot of anxiety, a lot of depression, and it's really interesting. A couple of interesting things. I want to echo, Marty, what you said about all these platforms. I'm going to date myself. I didn't know anything about Zoom. Zoom was a show I watched when I was a kid. It was on PBS in the 70s. So the fact that this came back around again is kind of funny to me. So it's all these things that, it's like a whole new learning curve. But to do these things, like you're saying, to be able to try to make those connections, and you're talking about the types of things that help people connect and be well, being able to use these platforms as tools. And I know a lot of agencies like ours and many others are using them so that people don't have to experience a lot of the things that we're seeing, which is just anxiety about the virus, just anxiety in general. I think, as was said earlier, it's all connected to uncertainty. But I just wanted to talk a little bit about depression because I know one of our MHA board members was COVID positive and mentioned on our call recently that they wouldn't describe themselves as a depressed person, but the isolation that they experienced while they were coping with COVID was just unexpectedly overwhelming for them. And, just having people be aware of that it isn't just the physical symptoms of the virus that are pervasive and need to be just aware of and to provide support for, but that there's a huge mental health component to that as well, whether you have the virus or you don't have the virus. And I guess, to Marty's point, I read the same statistic about, we used to always say the statistic was 1 in 7 people in the United States is impacted by a mental health issue, whether it be them or someone that they know. And now it's 1 in 2. And I would dare to say that it's going to be more than that because, it's all affecting us in different ways. And I think what's interesting to me is what was said earlier about people who are more comfortable to isolate. When the COVID crisis began, we were worried about people who needed services, how they were going to be able to get them, and the loss of their routine and being able to connect with their supports, what the impact would be for them. They're actually fine. They're home. They don't have any stress. They're doing what they're doing. And it's really more people like, that were going about their daily lives that, now their routines have been thrown off and they didn't have the tools before this happened to be able to know how to cope with these overwhelming feelings and experiences. So, and I'm one of these displaced people. I've been thrown into, now I'm trying to run an agency, I'm homeschooling, your whole life is turned upside down. And so, everybody has good days and bad days. And just as Jane said earlier, being able to, be mindful and check in with yourself about that and, know that you're not alone and to reach out for support because there's so many emotions and mental health components that are connected to COVID. And so just for people to be aware of that, just to really be tuned into that and know that it's okay. It's okay to not be okay. And maybe you don't feel okay today, but tomorrow's a new day and to try not to, take it all on yourself.
Thanks, Megan. Just to let everyone know that if you have a question that you would like one of the panelists to specifically answer, then use your chat feature to write that question and we'll get to it. But Claire, why don't you start with this third question? What information do you think is important for those listening right now on this webinar about someone who is experiencing a mental health condition? Maybe it's themselves, maybe it's a dear friend, a family member. What information, this is a very practical, do you think is important that we need to know?
I think it's important for people to recognize when somebody is reaching a point that they may need, help. When you're seeing, changes and differences in their ability to engage, whether, somebody's withdrawing or losing interest in something that they had interest in before. Irritability could be a sign that people could really look for, or more irritable, less reactive, more lethargic. Physically speaking, people could start, having aches and pains, okay, decline in hygiene, not taking care of themselves the way they used to. I think those are signs, that people need to, recognize and see in people and support them in actually getting help and support. It's also really important to remind people that, we don't always have the answers, and we're all kind of going through this together and learning, more about our needs as we go along.
Thank you, Claire. Marty.
Answer the question by sharing a clinical experience with a patient I had years ago. I was working with a man, I think he was in his 40s at the time, and he was very depressed. And I worked with him for a long time. At one session, he came in and told me he had just seen his physician and he was diagnosed with cancer. And he told me he was happy. So I said to him, "You were diagnosed with cancer and you're happy? I don't get it." And he said, "It beats depression." So when you talk about the murky, screwed up world of mental illness, mental illness is not something that you can go in and do an exact test. As psychologists, we give projective tests and objective format tests, but it's not like physical illness where you can actually show something. It's not like blood sugar levels. It's not like bone issues where you do an x-ray and but it's very real and it's very painful often to the person who's experiencing it. So, and most people, in my experience, normalize pathology rather than respond to it. They'll dismiss it. And dismissing it is probably the worst, most projecting thing you can do. But at the same time, you need to be very sensitive to the person, that you're not intrusive, or especially if the person is paranoid. If you see patients who are paranoid, who don't trust people, you can make like really big mistakes. So you really need to be calm and caring. The old expression we used to use was that mistakes of the head don't count, mistakes of the heart do. So if you're feeling something about somebody that you care about, you ought to think about how you want to address it. And sometimes either you do it directly with the person, or you do it with people that you trust, with professionals you trust.
That's really good, Marty, about being calm if you sense something.
Actually, you have to be objective about yourself. Everybody has defenses. We all have defenses. There's all stuff that we can process and stuff we can't. Okay, so sometimes we even go into denial about, unconsciously, we go into denial or minimization of what's bothering us. Sometimes you need help from other people, the people who love you, who tell the truth, not the people who yes you to death. Yeah. So sometimes people will tell you, hey, something's going on. And if you can take it and you can evaluate it, I think it was Claire who said it about people who are isolating. They're happy. I know kids who are still happy playing Dungeons and Dragons online, and COVID is something they're totally not tuned into it. Mm-hmm. And then there are other people who are watching 24-hour-a-day news updates on the coronavirus and what are today's latest stats. None of that is, I find, particularly helpful. I think it's much more helpful having discussions with one another and talking and getting feedback from one another so that we become more competent in dealing with it. We need to be competent, and this is really a test for us. Dolly Parton recently said she thinks that the coronavirus is a test from God. God sent us the coronavirus to learn more. How's that for positive thinking?
Megan, what say you? What information do you think is important for us to know if someone we think is experiencing a mental health condition?
So I'm going to agree with Marty that the assessment for diabetes and heart disease is different than it would be for mental health, to diagnose. But like diabetes and heart disease, mental health is treatable. That people shouldn't, buy into the stigma, it takes a lot of courage to be able to reach out. I'm one of those people, I'm there for everybody, but I hate to ask anyone to do anything for me. So it's just really important to be able to have the courage to reach out and let somebody know that you're struggling, that you need help. A lot of times it's really just having a connection, having a place to be able to share and to talk, before it escalates to being a crisis. So you hope that people have the supports to be able to make those connections. There are lots of warm lines, what we would call a warm line out there. Our agency offers one. It's a place where you can just call and talk. just to be able to get things off your chest, just to be able to bounce things off. I guess I just want people to know that they're not alone and that they should hold on to hope. The biggest thing is that we have a 24-hour, 7-day-a-week crisis hotline in Putnam County. And there's also a national Lifelines prevention number. So I just want to give people those that are on the webinar. So if they feel like they want to reach out to someone there and speak to them, that they can. So the Putnam County number is 845-225-1222. And that's 24 hours a day, 7 days a week. And then the national Lifeline number is 1-800-273-TALK. And they're also there 24 hours a day, 7 days a week. So you're not alone.
Thank you, Megan. Megan, I'm going to ask, as Jane is up next with her thoughts, if you could use the chat feature and give us those phone numbers.
Yes,
That
gladly.
way, because I'm sure someone's like, oh, that's good. But if you
I'll
want
put it
those
in.
numbers, put
I'll
in the
put it
chat
in.
feature. So
Absolutely.
yeah. So Jane, you're up.
Hi. I think that when it comes to knowing about someone who's experiencing a mental health condition, if someone truly is experiencing mental illness, one of the things to know, I mean, I think that idea of being on a spectrum is very, very important, as was said earlier. It's a matter of degree. But if one does have some significant mental health challenges, in dealing with that, it's important to know that you want to check in on the other person's perspective. I think it's important not to assume you know what perspective that person is coming from. As Martin said, that for some of us, it's a huge challenge to have your life turned upside down, and now you're working and trying to homeschool in the same space and time. But for other people who spent years feeling kind of not good enough or criticized in some way because their life was on the couch with Dungeons and Dragons, well, guess what? Now the whole world is okay with that, and they feel vindicated. And so it's really a matter of perspective, and it's important to check in on a person's perspective before you can be sure you know how to reach out to help someone. And it's very important to check in and see what do they say they need, rather than assume that we are sure we know what they need or what angle they're coming from on any given situation. I think it's also important to, in general, whether you be offering help or asking to receive it or hoping to receive it, to not see a situation in black and white. Our lives today have changed, but not everything in our lives have changed. People talk about, oh my gosh, everything has changed now. But okay, I don't go to the office anymore, but I still work, fortunately. I don't, the grocery stores don't look the same, but I still go to a grocery store. I still eat every day. I still get up in the morning. I still go to bed at night. I still have some contact with friends. There are certain things you can look around and say, these four walls are still here. And so it is important to say some things have changed, but not everything in the universe has changed, right? And to keep that perspective in mind as we hear so much media and so many people just talking endlessly about the new normal, everything has changed, oh my God. And at a certain point, the very talk about the situation becomes somewhat trauma-inducing and anxiety-provoking. Some of our lives have not changed 100%, and for almost everybody, a good portion of their life is still intact and still there. And that's important to keep in mind, to find the gray area between the extremes in any situation, including this one, is very, very important to keeping a reasonable perspective on things so that you can manage your life as well as possible. Because what's so important about this situation, and in talking to people and helping them through any stressful situation, is, can you adapt? I was talking earlier with staff today, my staff, And one thing I was praising them for was their ability to just roll over and adapt to a whole new way of working, and to do so very, very rapidly. And we all have. We've all, for the most part, adapted, as evidenced by this this Zoom meeting, which whoever heard of Zoom a month ago? Like, I never heard of it either. Now I'm hosting Zoom meetings. Today I scheduled one for the next 3 months with my staff. I had no idea how to do that, 2 weeks ago. So our ability to adapt is such an important thing to check in with when you're talking to somebody about mental illness, because a person's ability to adapt to whatever's going on in their life is what's going to make the difference between managing in a more healthy way and not managing and experiencing a significant difficulty with mental illness.
Thank you, Jean. Thank you for those that are kind of writing in some questions. We got just a couple more practical questions. Here's one. Marty, why don't you start with this one? What's one piece of advice would you give to someone who finds that they cannot cope with the grief, the anxiety, the depression due to COVID-19, or maybe it's unrelated to COVID-19? They're just filled with grief and anxiety, depression. What's one piece of advice?
Well, if it's the person who's suffering, encourage them to get help, reach out, put the big boy pants on and make a telephone call that you don't feel like making. Plan some positive activity. Don't just be passive. In other words, a passive response to trauma usually does not help at all. In other words, taking the position that, maybe it'll blow over, in my experience, doesn't happen. In other words, one has to take steps. If the person has a support group, I think you try to tell the individual to get help. And if they can't, then you talk to the people around them to help in the process. Sometimes it really does. Sometimes you need external help to move along. I used to work years ago with a woman social worker. She's probably my age now, but what she would do, if she wanted a child and a parent who were cold with each other to get more of a relationship, she'd actually put her arm around each of them and push them together physically, so they could get angry with her for doing that, but it helped to move things along. Because some people really get stuck on the dime, and it's important not to, so that you can facilitate it. So there's no easy answer to it, but it's the practical advice is get help, get help, get help.
Okay. Thank you, Marty. Megan, what's one piece of advice you give to someone? And that someone could be an adult, but it could be also a child. What say you?
So it's funny that you just mentioned about children, because I just wanted to pick up on, I think it was what Jane said about resiliency. Like all of this is really, it's a test in resiliency, and we were doing a lot of work around resiliency with children, and so this is a time for all of us to kind of heed some of those lessons. So, and just to Marty's point, I just think we all need to acknowledge that this is a trauma. This is a collective trauma. We just had a discussion in one of our staff meetings about this. And so, when people are having these feelings, just to say like, what's going on, there's something going on, and it's all affecting us in different ways, but just to acknowledge that that is something that's happening, and that's really a thing, and how you cope with that. So I just had in my notes, about what to say practically is really just, to hold on, to reach out and to connect. I know for a lot of people that I've spoken to, especially, parents who are homeschooling, people who are remote working, a lot of us have just had to lower the bar, as far as expectations. And I think a lot of times we put a lot of pressure on ourselves about, the way we think things should be. And I've grown to really despise that word. It's like a shame statement, like the way things should be. There is no should anymore. Everything's off the table. This is like something we've never done before. So just really to be kind to ourselves, think about self-care and do the best you can to manage the things that need to get done, and I'm sure there are other things that you want to do, whether they're things that you look forward to, or, necessary things that need to be taken care of. Like, I never want to clean my bathroom, but, that needs to get done. But just to be able to, break it down and try to prioritize and make things feel a little more manageable. And if that still doesn't work, just to reach out and ask for that help and ask for that support, because it's out there. And you're not the only one that's going through this. It's happening to all of us collectively. And, just how you feel today may not be how you feel tomorrow or the day after that. So I think Jane said it early on in the conversation, just about mindfulness and just checking in with yourself every day and seeing where you are and what you need, to be able to get through the day, and not being afraid to ask for that.
Thank you, Megan. I'm so glad for those of you who are joining in. I mean, this is wisdom. Thank you, Megan. Hold on, lower expectations. Earlier you said, hold on to hope. Hope is contagious. Jane, what's one piece of advice you would give?
Oh, do I really? I only get one? Uh-oh.
Well, two.
Oh, no. No, I'll try and keep, yeah. So, I mean, I think everybody's saying reach out, because of course, reach out. But I think, as it was also said, not everybody is ready to do that. And so I think that a lot of what has to happen before people can, pick up the phone and do something to reach out to another person, they have to make space in their head to take that action. When we talk about intakes at our clinic, we all know that intake appointment is the hardest thing to do, to make that call, to get into the waiting room. Everything after that it's easier. But that first step is the hardest one. So, a lot of people have to get undepressed enough to pick up the phone, or unanxious enough to pick up the phone. So, distraction, all right, so watch TV a little bit longer until you're distracted enough to pick up the phone when you're not realizing it. You maybe a little denial is a good thing in this moment, just to give you what you need to clear space in your head and make a little pocket of room to pick up the phone before you even know it. There's a saying, fake it till you make it. A lot of people have to do things like fake it till you make it, just to get through that first moment, because you can get through that first moment. The second moment is generally easier. And most people know that on some level, but it doesn't matter if you can't get through the first moment. So it's the first moment that is the biggest fork in the road towards whether or not you get the help, you reach out, you get some relief. When we, keeping in mind that whatever the stress of the moment is temporary. When we talk with people who feel self-destructive, it's so important to remember that whatever the stress of the moment is not going to last forever, and therefore delay the negative impulse, delay the self-destructive behavior, because this will end. When I packed up my stuff in the office and I came home, I stood in my office, I looked around at all that stuff that I operate with every day, and I said, what do I take? I don't know. How long will I be gone? I don't know. A week, a month, a year? I don't know. So and I was sort of getting paralyzed standing in my office thinking, I got to get out of this building like we're leaving, and I don't know what to pack. And I said to myself, you know what? A month. Let's just say a month. Pack what you need for the next 4 weeks. After that, if you have to come back, you'll figure it out. And if you don't, I guess it wasn't that important. I had to just say to myself something. It wasn't perfect. It's obviously been more than a month. But it got me out of the room. It got me able to put some stuff in a box and carry it out the door. And that was the goal of the moment, just to get to the next step, which for me in that moment was stop thinking, put some stuff in the briefcase, and walk out of the room. So if you can just do that much, there's another saying, if you feel like you're in hell, keep walking. Yeah, don't stop now. This is not the place to stop. This spot right here sucks. Get up and find a way to keep moving through so that you don't feel stuck in this moment. And that's all coping. People talk, I heard said, if we're not coping, but what does not coping mean? Does it mean, everybody's coping. No matter what you're doing, whether or not you're drinking or you're psychotic or you're, in the middle of finishing your PhD dissertation, all of that is coping in some way. Some people may feel like it's not coping well enough, but I think we have to give credit to people for the way they cope. And again, back to the matter of degree. You know, when a child is having a temper tantrum, they're not being bad, they're coping with whatever they're feeling in that moment. And we have to recognize that. So being able to say we're all coping in various ways. Do we feel okay about our method? If not, let's see if we can make room to do that differently. If somebody else thinks that the method you've chosen to cope isn't good enough, maybe they would be so kind as to say, can I offer you an alternative way to do this and offer the help you need to do it differently and listen to what you say. But I think we need to give ourselves credit and the people around us credit for whatever people do moment to moment to cope these days.
Jane, thank you. That was 100% practical. Claire, I know you you work a lot with children, youth. So we'd love to hear from you. What's some practical advice that you would give to someone, but maybe to the youth?
Okay, so, you know, the one piece of practical advice that I would give and actually do give is encouraging people to reach out to somebody who they trust. I'm really going to highlight, you know, trust, because we choose to trust people for many reasons, right? They bring out the best version of ourselves. They have our best interest at heart. They've guided us. They've supported us. That's what I would encourage. That's what I would say. That's what I do say. You know, remember those people around you who have, you know, pulled you out of, you know, dark thoughts or bad moments, and reach out to them.
Thank you, Claire. Last question for the panelists, and then we'll take your questions that you would have. The last question, and we'll have Megan, you'll begin, is what question? So if we put ourselves in the shoes of some, like, in one sense, we all struggle with mental health at times. What questions would we want someone to ask us? I think that would be very helpful.
So I thought about this question because, you know, we try to be person-centered, and, you know, it's just really important. I'm very famous for doing this. I call it helping that's not helpful. You know, I'm trying to do for someone what I think they need, instead of asking the person, you know, what can I do to help? So I think that's, you know, what the question would be is, you know, what can I do to help? How can I help you? How can I support you? What do you need? Is there something that I can do to make things easier for you? You know, what do you need? I'm just going to think about, you know, parents now that are homeschooling, and, you know, it might be something as simple as someone dropping a gallon of milk off at their house, or, you know, something that's really not so super significant, but for them, you know, that's going to be the turning point for them, for their day or for their week. It's something that they need, that they don't have the ability or, you know, the wherewithal to be able to do because of their schedule, or, you know, maybe their concerns about going to the store or whatever it might be. So just asking people what we can do to help, and then also just to remind them that they're not alone on this journey. You know, I was talking to my aunt the other day, and she said something so beautiful. She said, we're all in the same storm. You know, we might be in different boats, but we're all in the same storm together. And so what we can do to be able to help each other, you know, ride this out, because we will, but, you know, just different people are in different places of the storm, and just helping them be able to get through it. And I guess just to Jane's comment, Jane, I want to spend every minute of every day with you. So I love everything you said today. I just want to, you know, just to try to refrain from being judgmental, because I just feel like a lot of times people, their intention is to help, but the way that it's presented sometimes feels like judgment, and that shuts down a conversation, and that shuts down a connection, and that just puts, you know, makes the person not feel helped. So I know it can be hard because we're all struggling with our own stress and our own anxiety and being able to manage our own things. So sometimes it's not easy to be in the moment and think, you know, before we're speaking or we're acting, but just to really try to, you know, refrain as much as possible from judging anyone, because at the end of the day, we're all doing what we need to do our best to try to, get through each day and the challenges that are being thrown our way.
Yeah. Thanks, Megan. Jane, you're up.
Okay. So thank you, Megan. So I think that an important question is not, again, in the vein of being judgmental, following up on that is not what's wrong or what's wrong with you. It's what happened. Very often people are tempted to say, well, what's wrong? It's a hard question, or even when people are very frustrated, what's wrong with you? And as Megan said, that's a conversation ender, not a conversation starter. So if people are able to say what happened to you, because when people are not coping well, when they're using methods to cope that most of the world do not agree with, there's a reason. And so the most important question I think that somebody who is not coping well would wish somebody could get to is to care enough to ask, why are you doing it this way? What happened or what's happening to you or what did happen to you to lead you to need to do it this way? And then listen, because a lot of times people don't stop asking. They just keep asking without waiting for the answer. Or it takes a while for a person who's struggling to figure out how to answer, either because it's a difficult answer or they're not used to being asked. So the words aren't on the tip of their tongue and they need a minute to collect an answer. So taking the moment to listen to whatever answer is forthcoming and to give it the time to arrive is very, very important. And when it does, support isn't always in action. A lot of people feel like, for them, what makes them feel good as helpers, knowing that there's something I can do. I mean, we even say that to each other, right? Oh, I wish there was something I could do. And it's just, what we say. But actually, the very act of doing nothing, of just being with somebody, witnessing their experience, sitting there, listening to them, and witnessing their pain, witnessing whatever is on their face or on their shirt sleeve or going on right there and then, having somebody witness without running away or without insisting that it be different or trying to take action to change it, but just being there and listening, with to also kind of date myself to a very old phrase, unconditional positive regard. Not every problem requires an action to solve it. A lot of problems, certainly a lot do. And this global crisis needs action. But for somebody who is struggling in the moment with their feelings, often the most important thing you can do is to be there with a person, listening to whatever they're experiencing. And in that way, letting them know that whatever they're sharing for right now is okay.
Gene, that was great with the question. Don't ask what's wrong. Ask, tell me what happened or what led you to feeling this way. That's gold. Claire, you're up, and then Marty.
Am I unmuted? Okay.
Yeah.
So, it's interesting because a lot of the youth that I work with are, either identified, by either their family or a school or just, somebody that believes that they could really benefit from health and from mental health support. And I'm often, told like, God, there's so many questions. Why do you ask us all these questions? But one of the things that that's very common among youth is they always say, I really wish somebody would ask me what would make me feel better. And sometimes they don't even want to discuss, what had happened or what the current situation is right now that's really interfering with their overall well-being. And they really do just just want to have somebody say, what would actually really make you feel better? And of course, what is it that I can do to help that process or help that happen for you? So those are my questions.
Great. Thank you, Claire. Great. Marty, wrap this up. What questions do those who struggle with mental health wish that their family, friends would ask them?
It depends on the relationship. And listening to my fellow panelists talk, I'm reminded of a lesson I had years ago, was your job is not to help, your job is to be useful, okay? The need to help people who are suffering when you don't have a roadmap to help them sometimes is perceived as interference and not helpful at all. And I'm reminded specifically some years ago, after a successful suicide in one of the high schools, the guidance office decided to bring in every kid from that grade to find out whether the kids were suicidal. And I remember one kid, when he was brought in, he was asked, well, are you having suicidal thoughts at all? And the kid was a sarcastic kid. He turned to the counselor and said, no, are you? So the thing is, we need to proceed with care and caution and sensitivity, and beware of the trap of needing to help, because sometimes you can't help. And if you can't help, it matters that you're aware of that. And as the others have said, just being there, listening and figuring out what the person needs to say. Sometimes it's not asking the question at all. It's active listening that makes the difference. So too many questions sometimes.
Yeah. Thank you. This kind of wraps up these 5 questions. We do have maybe 7 minutes left to answer your questions. Paul, I know you've been I have some questions, but Paul, I didn't know if you had a question as I reviewed maybe some of the questions in the chat. Paul, do you have a question for the panelist?
No, more a statement. How about that?
Okay.
First of all, you look at things differently. You know what I'm looking at right now? People I can talk to that aren't wearing masks. How's that? I think of things like that right now, and it makes me feel good. I also think about people that were around much years ago. I talked to Marty about this privately. World War II lasted 4 years. We forgot that 80 million people died in those 4 years. People were sending children away to war, maybe never seen them again. There was no email, no nothing. You want to talk about stress? I think about it. This isn't so bad when I think of those things. Or my mom telling me stories how it was coming over from Europe, where she finally had a toilet. Talk about the depression, the real, and that's just me. But Megan and we go back a ways, and I don't want to forget people like my brother who's mentally ill. When you're that level, God knows they don't understand it at all. You could talk to you blue in the face. It's just, you know what I'm saying, Megan? You understand what I mean? Those people should not be forgotten. They are right now. They're struggling their own because they don't understand it. They just don't understand it at all. And that's about it.
Thanks, Paul. We do have a specific question from Carrie to Marty. She just this is a quick question. Marty, do you currently see new clients and or children?
The answer is yes.
Okay. Marty, I would maybe if you want to type in the chat feature.
I don't need to type anything. Just go on to Psychology Today, type my name in, and you'll get all my information.
Okay. All righty. Let me ask, again, if you have a specific question, go ahead and type it in the chat. Let me ask this question for any of our panelists to answer, and that is, what is what's the relationship between religion, faith, and mental health? This is for any of our panelists. If you want to go at it, just unmute yourself.
I'll do it. One of my current affiliations is with the Foundation for Religion and Mental Health, which provides counseling services, usually in a faith-based and ecumenical setting. So we have Protestant Jews and Catholics. I don't know that we have any Muslim, but we're working on it. Anyway, what's important is belief and faith in a higher power. I have worked with many patients over the years who have identified themselves as atheists. And what I've observed is that atheists are usually depressed people. And when I listen to them talk, I can't help but think and say to them, well, no wonder you're depressed. You don't believe in anything higher than yourself. In other words, and on the previous question about people who can't cope, was it Megan or who said about people are coping all the time, or was it Jane? One of you said that. Actually, the truth is people can cope with certain things and they can't cope with others. So if you see a kid who can't do homework, he can read comic books. Actually, when I think about it, when I was in graduate school, I had brilliant classmates who used to, in their spare time, read comic books. They weren't reading the boring textbooks about anxiety and depression. They were reading comic books, okay? So what you want to focus on are strengths and interests. Rather than just go for the pain, don't go for the pain unless you have a very close relationship with the person who's hurting. In other words, people can turn on us very quickly. I've learned the hard way that when you have somebody who thinks you're great, they can think you're terrible in a month or two because you've done too much or not really tuned into where they're at. So it's important to really try to tune in to the people that we're trying to help. And it's not easy. And as somebody said, we're not in the same boat. We're certainly on the same ocean, that's for sure.
Yeah. Thank you, Marty. Anyone else wants to take a jab at that question? What's the relationship between religion and mental health?
I will, Travis.
Sure.
It's Megan. I'm reading a book right now that's been really great, and it just really refers to spirituality and having that connection. And I've just noticed it's been a very, it's just anecdotal, but an observation that a lot of people that I'm close to who have, faith really at their core and at their center. Sure, they're experiencing things related to COVID, but I think that they can kind of take a step back because they feel like two of them have said to me, like, not to have fear, like somebody else is driving the boat. So obviously to do everything that you can in your power to make you feel like, you have a sense of control, you have the things that you need. And that you, as was said earlier, that you have the tools to be able to get through your day and to live your life. But to not feel like it's all on your shoulders, that there's you have faith that you're not in it alone, and that someone else has a plan for what's happening, and we may not know what that is, but just to kind of rest assured in knowing that, if that provides comfort for people, and for some people it does, and other people, that makes them very uncomfortable. So again, just as we've discussed the whole time, just looking at everyone as themselves, as an individual, and knowing that it isn't a one size fits all, and that people have different tools that they're going to use to make them feel better in different situations. And so I would just say that spirituality, I think, is an important tool that it would be wonderful if people had in their toolbox.
Good. Thank you, Megan.
I was going to say, and following what was just said, I think that being able to have some faith reflects the ability to realistically recognize that you can't control everything in the world. And one of the things that I'm aware of in talking with clients is that a lot of the difficulties in people's lives stem from, and not just clients, just everybody, stem from the wish and belief that they should be able to control things, or things should go their way. They should be able to make it happen. And when they can't and they hit a brick wall, it's so enraging. And then people react to that with pain and anger because they couldn't make somebody do it, or they couldn't make somebody get it to happen. And, you know, that's just not realistic. A great deal of the time in sessions I spend with people is discussing what is realistic, what is likely to happen in the world. And if there's a gap between what you want to have happen and what really is likely to happen, the bigger the gap, all that space is filled in with pain. So the narrower, right, if reality and what's likely to happen is very, very close to what you want to have happen, look, no room for a lot of pain and misery. That's what you want to do, close that gap. And one way of doing that is to recognize when things are just not in your control. And that's a very difficult thing for people to consider, but having faith means a recognition of that. And a lot of people want to, you know, there needs to be a reason for a lot of people. And for a lot of people, especially those that we work with in my clinic, they can't turn to their families and they don't have any friends. Their families have mistreated them, or for whatever reason, they're in bad relationships with their families and they're isolated. They've never learned to make friends. They feel very alone in the world. So they need something else to turn to. And having faith in a higher power can be what they need to say that there is something out there beyond friends and family. And for many people, when family have failed them and they don't have friends, you know, a faith-based outlook keeps them going when there isn't much else in the world that does.
Thank you, Jane. Claire, any thoughts to that?
You know, I think there's a very strong connection, and I think that it's very important to learn about the people that you're working with. You know, if that exists, because if that does exist, I do believe that it can inform treatment. I believe that it can also be an incredible support for them, you know, even when services are you know, completed, that they can, you know, always have a you know, a religious or spiritual group or connection that they can use just to help resolve, you know, future you know, difficulties or traumas. So I do believe it's something that you need to learn, and if it's about the people you work with, and to really help develop that and foster that, because in the long run, it's probably the best thing for them.
Thank you. Well, a huge thank you to our 4 panelists, Marty, Megan, Claire, Jane, for your for giving us 90 minutes of just a lot of great information, practical. I know some of us couldn't make it, so this is recorded, and we'll send out the link. Thank you to Brewster Rotary for willing to partner with First Baptist Church in Brewster to provide this. And that's one of the benefits of online, is that while one might not have been live now, but they can watch this later, and this can be shared. So again, thank you all. I'm going to turn it to give Paul the last word, and then we'll be done. And
Take off your screen share, please.
okay.
Myself?
Paul?
From me, Travis?
Yep, Paul, if you want to just to say the last word, and then we'll be done.
Very, very quickly, I am so honored to know you people. There's my faith. You hit on faith, and it's important to me. It's the basis of everything for me, without describing it. Megan mentioned fear. You should not fear. Fear is a feeling. When it was said to us not to fear, maybe it doesn't mean it means not to have the feeling. Let the feeling go. It's nothing. You know, maybe that's what it meant, if you can understand what that means. I learned a lot from my dog. My dog doesn't fear, smiles, walks around. But anyway, I love you guys, and thank you so much for including me.
Paul, I want to tell you that Nikki doesn't fear either. So like we
There
should
you
all
go.
take
go.
a lesson. We should all take a lesson.
Megan, I've said it to you a million times. He is so much better than me. He's the better brother, not me.
Well, I'll argue with you about, but anyway, yeah. Thank you for having us.
Yeah. Thank you again. And God bless you.
Thank you.
Thank you.
Be well, everybody.
Bye-bye.
Bye-bye. Thank you.
Bye.
Thank you.
That went well. Okay.
Jan, you look good with no cigar over there.
Thank you, Mindy and Jan. You guys did a great job. I need you guys. This is going to be a new gig now. You're going to do everything virtual. So good job. Good to see you.
Thanks,
All right.
Megan.
Safe and healthy.
Nice seeing you again.
Good to see you too.
I feel like the Brady Bunch.
I know. This is like, right?
Goodbye.